Good morning.
Good morning.
Morning. Now, before we start, does anybody have any questions? Nothing yet? So far everything is clear? Okay, guys. Then let's see if we can continue. So what we did yesterday was we talked of the anterior cavity, which we said was divided into the thoracic cavity and what we call the abdominal pelvic cavity. We also said that these two cavities here were separated by a sheet of muscle called diaphragm. Okay. So what we will start talking about today is going to be the abdominal pelvic cavity. Okay. And it's not going to be an empty space because we need to fit some organs into it. Clear? Okay. So that was just a quick review. So now, guys, the way that I usually do it is I say it's okay. Abdominal, and then we just have some. We can say pelvic. Yeah, okay. Now, let's just move this over a little bit. Because, and we can mainly say it's okay. Let's just distribute it into the systems. So mainly it's okay, the systems, which organs or structures just okay we find in the abdominal and pelvic cavity. One is going to be the digestive system. Yeah, okay. Another system that we'll find which organs are distributed in the abdominal pelvic cavity is going to be the urinary system. Yeah, okay. We can say, what else do we have? Okay, we can say, let's do that at last. Then we can say, it's okay, we may have, let's say, it's okay, others, which means okay will be things such as glands. Okay, good. Now, guys, if we start with the digestive system, the first structure that we come across in the element, in the, what you want to call it, in the abdomen, is going to be the stomach. Okay, we already said yesterday that, okay, the esophagus comes and joins with the stomach. Now, I hope everybody know that, okay, the word for stomach is gaster. Yep, okay. After that, now that means it's okay going to lead into it's okay what we'll call the small intestine. Okay. Now what we said was that the word for the small intestine was enter. Now, guys, this small intestine here, okay, actually is going to be it's okay be divided into 3 parts. Okay. So the 3 parts of your small intestine. First is going to be, it's okay, what we'll call the duodenum. That will lead into, it's okay, what we'll call the jejunum, which will lead into, it's okay, what we call the ileum. Okay. So this is pretty much okay as the sequence of parts of your small intestine. Right. Which means it's okay, just okay, it's a long, it's okay, tubular structure. What we can say is okay, the small first part is going to be the duodenum. The second part is going to be, it's okay, the jejunum. And the last part is going to be the ileum. Clear? We can from duodenum say it's okay, duodenal. From jejunum we can say it's okay, jejunal. And from ileum we can say it's okay, ileal. Okay. But that's okay. These are the names. This means okay. This means pertaining to the duodenum, pertaining to the jejunum, and pertaining to the ileum. After which, it's okay. The large is okay. The small intestine mainly is okay enters into is okay what we'll call the cecum. Yeah, okay. Now for cecum, yes, okay, you can say cecal. Now this cecum here is mainly going to lead into, yes, okay, what we'll call the large intestine. Which we know is okay, go under the term, or is going to refer to as the term, colon.
So the cecum is like the end part of the small intestine?
No, it actually is okay, comes under, yes, okay, the large intestine.
Oh, it's under the large intestine?
Yeah, yeah. Okay, but what it, okay, my dear, what it pretty much, okay, just is just this little structure into which you can say it's okay that the small intestine enters. And after that is okay, that's where you have, okay, yes, you can say it's okay, your large intestine. But this first part here is just going to be, it's okay, what you call the cecum.
Oh, so your small intestine is on like the bottom and the large intestine's on the top?
Don't worry about where it is right now.
Okay.
Okay, dear?
Mhm.
That's going to be, it's okay, what we talk about in anatomy, physiology. Now your large intestine, dear guys, okay, yes, just like the small intestine, also can, it's okay, be divided into parts. Okay, which mainly is okay, are going to be, it's okay, what we will call the ascending colon. Then we have, okay, yes, the transverse colon. And last is going to be, yes, okay, the descending colon. Did you guys get that? Now, what the descending colon is going to do. Okay. Let's shoot this guy. It's okay, whatever is of your digestive system, or let's say it's okay, your gut, if that's what you want to call it, continues in the pelvic cavity of the abdominal pelvic cavity, which is going to be, as okay, primary, as okay, what we call the sigmoid. Okay, and okay, some people may even call this, okay, the sigmoid colon. Okay, so due to, as okay, some people call it the sigmoid colon, as okay, it will still be considered as a part of the colon or large intestine. Okay, but it runs in the pelvic cavity. The reason that they call it the sigmoid colon is mainly as okay because sigm is just the Greek word for the letter S. So it's okay mainly because it has a shape that looks like an S. Okay, S alike. Okay. Did you guys get that? But this sigmoid colon here is okay, is going to continue into what we call the rectum. Which continues into, yes, okay, what is going to be referred to as the anal canal. And empty out via anus. Did you guys get that? Okay, so from top to bottom, this is, yes, okay, the sequence in which the things run. Okay, where these are literally as okay within the abdominal part of the abdominal pelvic cavity, and these structures here okay fall within the pelvic part of the abdominal pelvic cavity. Did you guys get that? Now, guys, the urinary system. And urinary system is okay, it's a pretty small system, not really much there to talk about. But mainly it's okay, falls within the abdominal course or limits of the abdomen is going to be the kidneys. Now for the kidney, it's okay, we either use the word ren or we use the word never. Your kidneys are going to, yes, okay, lead into, yes, okay, what we call the ureters. As far, okay, as the abdominal part of your urinary system, yes, okay, that's what comes in that. Where, okay, yes, the organs of the urinary system that falls into the pelvic cavity is primarily going to be what we call, it's okay, the urinary bladder. And okay, yes, it will lead out through what we call the urethra. Is that clear? Now what we can say here is going to be others. Now what I say when I say others, yes, okay, what is that we will have under that? Which falls within the abdominal pelvic cavity. Mainly is going to be, yes, okay, we can say the liver. Now the word for liver was hepat. Okay, we can go along, we can say, yes, okay, along with the liver, yes, okay, what do we have? Or we could call it, okay, the gallbladder. Gallbladder, cholecyst. Another organ or another structure, yes, okay, that we have in the abdominal cavity is going to be what we call the pancreas. Okay, and it goes under the same name, yes, okay, whether you talk about it refer to it in English or medical terms. There's going to be another organ, sorry, that we call the spleen. Just going under the term spleen. Clear? Okay. We will have another organ, or gland actually, sorry, which is going to, yes, okay, be referred to as the adrenal gland. And that's what you call it in English and in plain medical terminology as well. Did you guys get that? Okay. Now, another thing that we also may have in the abdominal pelvic cavity, we can mainly say, okay, let's just do it this way. Let's see. Blood vessels. I'm just going to say, okay, the major. All of these details about, individual blood vessels and so on, so on. So we will talk about that when we get to, towards the end of anatomy and physiology. Okay, but what we have in the abdomen part is mainly going to be, the aorta that continued or came from the thoracic cavity. And what we in the abdomen is, we'll call the inferior vena cava. Okay. Now for the aorta part, the pelvic or the vessels that arise from the aorta in the pelvis are going to be what we call the common iliac arteries. Whereas we can say the inferior vena cava. Okay. What joins to form the inferior vena cava, which comes from the pelvis, are going to be the common iliac veins. Did you guys get that? Okay. Now, guys, and just for a sec, do anybody want if I just go to another slide?
Oh, just 1 second. Okay.
Okay, guys. Now, and please mind my words. And I will say, most of the abdominal organs / glands are covered in a 2-layered membrane called peritoneum. Is that clear? Now, first thing first. Why do I say most and not all? Because it's not going to be all of your abdominal organs that will be completely covered up in peritoneum. Okay. So since we said most, that will mainly mean that, okay, yes, some of the, yes, okay, we can say abdominal organs, okay, will only be having peritoneum. I guess that's okay, running. By its front surface. Okay.
I'm sorry, can you read that last part one more time? Some of the abdominal organs, what after that?
Some of the abdominal organs will only have peritoneum running by its front surface.
And what's that word after two-layered membrane?
Called.
What is it?
Called.
Called.
Yeah. Okay. So the organs in the abdomen where you only have, yes, okay, peritoneum running up against its front surface, or what we actually refer to as anterior surface, are known to be retroperitoneal. Yeah, L here, yes, okay, is our favorite which means pertaining to. Periton is peritoneum, and retro just means behind. So they fall behind the peritoneum, which may mean that the peritoneum only, as okay, runs on their front surface. Did you guys get that? Now, what I said yesterday was, that's okay, we have membranes. We have a membrane. And it's okay, it starts with a P. Okay. We also said, okay, this two-layer membrane, this membrane which starts with a P, has two layers. One is going to be an outer layer. One is going to be, yes, okay, an inner layer. And the outer layer is going to be called the parietal layer, or in this case, again, like a parietal peritoneum. And the inner layer is going to be called the visceral layer, or visceral peritoneum.
Sorry to interrupt. I just was, so the retro peritoneum,
Peritoneum.
that's behind the
Exactly.
like the regular
Okay.
peritoneum.
Yeah.
Okay.
Okay, that's fine. Okay, we can get back to that in just a second. And what do we have in between these two layers? It's going to be a fluid, which doesn't have a fancy name like CSF. But in this case, it's okay, since it's the fluid in the peritoneum, it's going to be called the peritoneal fluid. Did you guys get that? Now just look. Because most of the structures in your abdomen are going to be as okay tubular. Mainly as okay if you talk about things like okay as your gut. Okay, it's just okay as a long tube, a tubular structure. Okay, which means okay just twists and turns around or it's coiled around in the inside your abdomen. Okay, but most of it, and again, that's okay, I say most of it because I'm going to be all of it is going to be completely covered up in peritoneum, just like my arm here is completely covered up in the sleeve. Did that make sense? Did that make sense? Now, in some of the areas of the abdomen, there are going to be organs where the peritoneum is only going to run in front of it. They're not going to be completely covered. Just like, okay, if I was wearing an apron, that apron is going to only run and cover, okay, the front of my belly here, right? Okay. It's not going to cover my back. Did that make sense? Okay. So if you say that way, yes, okay, you can say, okay, my belly would be, if I was wearing an apron, behind the apron. So you can say, okay, retroapronic or something like that. Okay, behind the apron. Did you guys get that? Okay, so that's okay. As far as we got, just okay, talk about organs in the body. Oh, sorry, in the abdominal cavity. Okay, all dependent upon us. Okay, where they are completely covered up in peritoneum, or we can say, okay, just partly covered up by us. Okay, the peritoneum running in front of it, which make them become lying behind the peritoneum, which we will just refer to as being retroperitoneal. Did that make sense? So let's just look at our organs here, and okay, just to make it colorful, we can say, okay. We can say, okay, we talk of peritoneum. Let me just choose a color that we haven't used. Good. So we can say, okay, this, we will call this, okay, peritoneal. And when we say peritoneal, that's okay, what we mean is, okay, just will understand from that is that these will be organs which are completely covered up in peritoneum. Whereas on the other hand, we can say, it's okay, we will have what will be referred to as retroperitoneal. And what would that mean? That's only going to be as okay, the front surface of these organs that will be having the peritoneum running. They're not going to be completely as okay encircled in peritoneum. Okay. Did that make sense? So let's just go with the peritoneal organs first. Organs within your abdominal abdominal cavity, which are completely covered up in peritoneum. And one is going to be your stomach, completely covered up in peritoneum. Okay, guys? Your jejunum and your ileum completely covered up in peritoneum. The cecum completely covered up in peritoneum. Okay? All of your ascending colon, all of the transverse colon, and most of the descending colon will be covered up in peritoneum.
Can you say that again?
All of your ascending colon, all of the transverse colon, and most of the descending colon is completely covered up in peritoneum.
And what was the word that you said before talking about the parts of the colon? And it was
Ascending, transverse, and descending.
like before you talked about those three ones. You did say a word that I didn't catch.
Cecum.
Oh yeah, that one. Thank you.
That's why I put the colors, my dear. So what would the green, dark green color mean? That these are all completely covered up in peritoneum. Now your glands or organs, liver, and the spleen. Did you guys get that? Which mainly makes your duodenum, which is the first part of your small intestine, is going to be retroperitoneal. Because it says, okay, that very last part of your descending colon is going to be retroperitoneal. Both of your kidneys and yes, okay, the ureters are retroperitoneal. Your pancreas are retroperitoneal. The adrenal glands are retroperitoneal.
Excuse me? Oh, I understand.
And both,
I understand the color coordinating in the lines. Would it be possible if you could just do a slide of what is retroperitoneal and what is not, just because all of the lines are kind of with the arrows is just kind of confusing.
no, it's pretty straightforward, my dear. Look here. So a line, the coloring line on top of it means okay, indicates which one it is.
Okay. Well, thanks anyways.
So what's the dark green again?
Those are structures which are completely covered in peritoneum.
They're peritoneal.
You can put it that way, yeah.
And then what is the blue?
Retroperitoneal. Which
Thank
means that they lie behind the peritoneum. Which mainly means that, okay, yes, it's only going to be there. The front surface of these organs which has the peritoneum running up against it. Now where it is your aorta? or whether it is your inferior vena cava. They are both retroperitoneal.
Sorry, is it the gallbladder or the adrenal gland that's the retro one?
No, it's the adrenal gland. That's
Okay.
why I use a line on top of it, my dear.
Thank you.
Yes, but it's a little confusing when there's lines on top and on the bottom of words. So that's why I,
No, okay, here. That's your adrenal gland. That's your pancreas. So whatever color you see is okay. On top of it, yes, okay. Any questions? So mainly because that some organs falls behind the peritoneum, only occur on their front surface, while peritoneum happens to be retroperitoneal.
So the ones that you didn't underline, does that mean that it's not covered at all? It's not being protected at all by anything?
Mm, no, my dear. Here, this line mainly mean that, okay, these were the parts of your small intestine. Okay, when I say large intestine, then these were the parts of it.
Okay.
Okay. Now, guys, okay, we're probably going to get.
What about the gallbladder?
Yeah,
Is that's retro or
yeah, it's neither.
it's neither? Okay.
Yeah. Okay. Any other questions?
So just a general question. For the test, well, we need to know just the main points, or will we also need to know all like the sub points that you're giving us as well?
You're breaking up the land, my dear.
Sorry, I was asking for the exam.
Yeah.
Will we only need to know like the main points, or will we also need to know like all the sub points that you're giving us for the
Well, okay,
exam?
for now, you will have to know it's okay what it means to be peritoneal, what it means to be retroperitoneal. Okay, all of this here. But okay, it's going to just okay get repeated again in anatomy and physiology. Okay. Now, guys, we're missing out a system, which is the reproductive system. And guy mean says, okay, that all of, okay, as your all the organs of the reproductive system, fall into the pelvic cavity. Okay. Now we can just say, yes, okay, now what are the structures of the male reproductive system? And it's going to be, let's just start from an end. We can say, yes, okay, the testes. Now from the testes do we have a structure called epididymis, which leads into the vas deferens, which becomes the spermatic cord. And okay, as it runs through, is okay, the penis, it becomes ejaculatory duct. And then there's, okay, urethra. We also have an organ called the penis. Okay. Now, although not necessarily as, okay, a part of the reproductive system, but there's a gland called the prostate gland. The female. Now, the equivalent to the testes in the female is going to be the ovaries. We can mainly say as, okay, the equivalent to, as, okay, the ductal system in the female is going to be as, okay, what we call the fallopian tubes. Okay, now, a technical word for the fallopian tube is salvings. Some people may not like the word fallopian tube, so they may just, okay, just call it the uterine tubes. Oh, sorry, ovarian tube, sorry. What the ovarian tube, sorry. Okay. Then we have, okay, as the uterus. And the uterus leads are via the vagina. Okay. And we can mainly say that, okay, yes, now the floor of the pelvis or if you don't want to say pelvis, you can say, okay, the pelvic cavity. the floor of it, or form, is commonly known as the perineum. Now, the perineum in the males have what we call the scrotum. That's that sac in which the testes are stored. Whereas, okay, in the females, now since female doesn't have testes, okay, or what becomes the scrotum in the males, equivalent is okay in the females, or in the female, okay, what the two is going to be what we call the labia. Now there are going to be two labias, but okay, that's fine. Minora and majora, but okay. And okay, so what in the male becomes the scrotum, and the female becomes okay, what we can call it, okay, the labia. That okay scars the opening of the vagina, or what you can call the birth canal. But all these structures, that's okay, whether it's the male or whether it's the female, it's okay either. That's okay in the pelvic or part of the pelvic area or pelvis.
Can you clarify what the in the males what the word speron, what is that?
Spermatic cord.
Spermatic cord.
Yeah.
Thank you.
No problem. Which then in the prostate mainly, it's okay, this become what you call the ejaculator duct. And okay, this runs along the penis, and yes, okay, what do you call, not okay, empties into the urethra, which runs through the penis. So, any questions?
I had one question.
Yeah.
So I know you said for the abdominal cavity and pelvic, there's the digestive system, urinary system, and then you said glands, like you wrote glands down. Would it be the reproductive system too?
No, but no, because that becomes a different system. Okay. Now, okay, if you guys want it, well, okay, we can always do it. And if we look at the glands, we can say, good. Now it's going to be lines again. So, okay, let me just make a star. Mark it with star, the color. So your liver, it's a gland, not really a gland, it's an organ that comes under your digestive system. The gallbladder is a gland that comes under your digestive system. Clear? Okay. the pancreas is a gland that falls under your digestive system. Is that clear?
Yeah, I get the gland parts. I was
Mhm.
just wondering, like, because we just did reproductive system and you didn't write it under the abdominal pelvic, like what systems are.
My dear, if you look here, I said all the reproductive system falls within the pelvic cavity.
Okay, thanks.
Does that make sense to you?
Yeah.
Okay. Now, just a gland that I want you guys to just look at. And just look at the name. Gland is gland because it secretes something, right? This fellow here is he secretes a lot of things. But if you just look at the name of it, adrenal gland. What do we have? We had two words. We had ad, and we can say it's renal. Now here you can say it's the L is just our favorite, pertaining to ran, which becomes your kidneys, right? Right. So just by looking at the name of this gland here, it's by its name really, say that it has something to do with the kidneys. And that's in the word ad, which mainly just means close by. And yes, when we talk of the adrenal gland, it's actually going to be on top of your kidneys. Like this. That's going to be where the adrenal glands are. Okay. Now, you may have heard of a substance called adrenaline. Now, where did that come from? From the adrenal gland. Did you guys get that?
So adrenaline is the hormone made in the adrenal gland? Okay.
Yes. But I think you have heard of the word adrenaline, right? Good. What is it that adrenaline does?
Like energy, or well, not really energy, but
Not really energy.
I don't know how to describe it. I know what it does.
Is it like your fight or flight? Like
Fight or flight, exactly. When we are scared, there's only two things that you can do, right? Okay, so it's the three F's. Fright. Well, that mainly just sounds when you're afraid. Or get scared or or whatever. The killer clown just jumps over in front of you, right? There are two things that you can do. I say, I'm getting out of here. And what would you do? Pew. Or you say, hell no, I'm not a quitter. We're going to have a fist fight now. Probably not. Okay, so either is okay, you flight, yes, okay, escape. You say, well, okay, come on. And guys, in both cases, okay. Now, have you ever wondered why in the Pim Pam Blue is it that, okay, yes, your heart go, it's not because you got scared. It's mainly as, okay, just to keep you fit or be able to just, okay, run that fast. Or as, okay, just keep you pumped up if you take up the fight. Did that make sense? Okay, guys, but just look here then now. Because, okay, we said adrenal gland. Okay, it's going to be called the adrenal gland. But I'm just going to use another term. And we just say it's okay, epi. Then I say nepher. And then I say in. Now I hope all of you, yes, okay, will agree upon that the word nepher means kidney. The word epi is more specific because it actually is okay means a bowel. Or we can say it's okay on the top of. And what the iron here is okay means okay indicate that okay this is a substance. So there's a substance called epinephrine, which is chemically, functionally the same as adrenaline. Have you guys heard of the EpiPen? What is it that they have in the EpiPen? Epinephrine. And what is it that the epinephrine does? It just raises your blood pressure. Because that's pretty much okay what somebody may need in case of shock. Okay. So that's okay. One thing that may happen that okay is because you are not able to run. If you see it's okay a grizzly bear standing in front of you. Of course, if we have a dumb idea to try to take up a fist fight with a grizzly bear. Clear. So what's going to happen next? Boom. You may collapse. Due to it's okay being scared. And that'll probably that's okay the best thing to do. Okay. If not actually dead, act dead. And Mother Nature may help you with that. So, yes, guys. So what is the membrane in the abdominal cavity called? Peritoneum. What is the membrane around the lungs called? Pleural membrane or pleura. What is the membrane around the heart called? Pericardium. They all started with the letter P as in Peter, Patrick, Patricia. Clear? All three of them were made up of two layers. An outer layer called the parietal layer, inner layer called the visceral layer, and in between those two layers was going to be a fluid which was just named after the membrane itself. So in the pleural membrane, you had pleural fluid. In the pericardium membrane, in the pericardium, you had pericardial fluid. And in the peritoneum, you had peritoneal fluid. Clear? Okay. So what did we call the membrane that's covered up your not circular, sorry, central nervous system, organs of your central nervous system? That was what we call the meninges, which had three layers. Clear? Outer dura mater, sorry, arachnoidal layer, and the pia mater. Clear? Okay. And in the, what you can call as, okay, subarachnoidal space was the fluid that we call the cerebrospinal fluid. That's where that is going to be circulating. Right, okay. Now, if you get an epidural, that's because they inject medication on top of the dura mater. It's just going to, penetrate through, your meninges and get to the spine. And that's why you may not feel anything from that level and below. Because just you can say numbs or blocks the transmission of signals at that level of the spine and further down. Did you guys get that? Right. Anterior cavity was divided into two subcavities, abdominal pelvic cavity and a thoracic cavity. Posterior cavity divided into two subcavities, the cranial cavity and the spinal cavity. Any question, guys? So just a quick review. Yes, okay, we have some questions on, in my book, it's 53. May not see it clearly, it's okay. So let's just look at these. Okay, guys. So should I just read the option and you go with the cavity? Membrane surrounding the lungs.
Flora?
Plural, yeah, exactly, good deal. Okay. Space between the lungs containing the heart. The space between the lungs.
So
Yeah.
thoracic.
Huh?
I was gonna
Yes.
say the thoracic cavity.
Nope.
It
That would not be the
mediastinus.
mediastinum, exactly. Okay. Your pleural cavity comes within the line. Okay. No, that's okay. Or your lungs comes within the thoracic cavity. Okay, dokie. Get bones of the hip. Now that's going to be your pelvic bones. Okay. So if we, okay, sorry guys, probably didn't talk about that. So if you say that this is your torso, we can say it's okay here. That was the diaphragm. Okay. So this here is okay, become the thoracic cavity. Where we can say it's okay, all this here is going to be okay, the abdominal pelvic cavity. But here, guys, is what you can call it, okay, your hip bones. So it's pretty much okay. Just this part here, so it becomes the abdominal cavity. And we can say it's okay that this part here becomes the pelvic cavity. Okay, mainly because, okay, the main bone of your hips or your hip bone is called the pelvic bone. Or I call the pelvis. Okay, which on one side is made up of 3 separate bones, and on the other side are made up of 3 separate bones. Okay, and at the back, is okay, will be joined by another bone. Oh, it's okay, which is a big bony plate, but actually it's okay, made up of 5 bones. We'll talk about that in just a little bit. But that's okay, your pelvic or pelvis, if you want to put it that way, is mainly it's okay pertaining to your hips. The bones of the hip is going to be as okay, the pelvis. Now, space containing the liver, gallbladder, and stomach, also called the abdomen. Now, once they say space, it becomes a cavity, also called the abdomen. So that becomes your
Abdominal cavity.
abdominal cavity. Exactly. Very good. Okay. Now we can say next one is space within the backbones contained in the spinal cord. Here the answer is in the question. You say space becomes a cavity.
Spinal cavity.
Exactly. Okay. Now membrane that's okay surrounding the organs of the abdomen.
The peritoneum.
Peritoneum. Okay. Good. The space within the skull containing the brain.
Cranial cavity.
Cranial cavity. Okay. How did you get that space? Cavity? Skull, cranium. Okay. Good. Space below the abdominal cavity containing the urinary bladder.
Pelvic cavity.
Pelvic cavity. Very good. Yeah. Okay. Now, muscle between the thoracic and abdominal cavities.
Diaphragm.
Diaphragm. Exactly. Very good. Good. The entire chest cavity containing the lungs, heart, trachea, esophagus, and bronchial tubes.
Thoracic cavity.
Thoracic cavity. Okay. Good. Okay, guys. Okay, guys. Let's just talk a bit about the division of our backbone, if that's what you want to call it, or spine. So guys, if we take the spine. Right? Which we also, in this case, okay, we can call it the backbone. Okay. Now, just because it's called backbone doesn't mean that it is not one bone. But it's actually made up of 33 bones stacked on top of one another. Yeah, okay. Now, out of these 33 bones, some will be fused together. Now, when we say fused together, it mainly will mean that they will appear as one big bony mass. Well, how? Mainly because, multiple bones were fused together, joined together to appear as one bone. But practically, is made up of more than one bone. And some of these bones here are not going to be fused. Okay. Okay. So now, guys, the divisions of our backbone or spine, if that's what you want to call it. Okay, these divisions here are mainly just we can say named all dependent upon the region which they fall. So the first one, the first division, we can just say like this, for instance, is going to be what we'll call cervical. Okay, here, L is saying this or pertaining to cervic. Actually comes from the word cervix. But what I have said is that always the word start ends with an X. Whereas you want to put a suffix with it, the X actually gets replaced by a C. So from cervix it becomes cervical. Okay. And actually that's the bones that makes up your spine are going to be called vertebra, or one vertebrae or multiple. So that's the first part of your spine or backbone, main is going to be what we'll call the cervical. And that's mainly because the word cervix actually means neck. Okay, so the vertebrae that falls within your neck are going to be the cervical vertebrae. Now, the number of these cervical vertebrae here are going to be 7. So you can say Did you guys get that? So the word cervix actually means neck. Cervical will be pertaining to neck. So you can say cervical vertebrae. Okay. Now they are going to be labeled using the letter C mainly because from cervix or cervical. So we can actually say, okay, 1, 2, 3, 4, 5, 6, 7. So we're going to be labeled from C1 to C7. Did you guys get that? The next part of this, okay, the backbone, which is probably, okay, the biggest one, is going to be, okay, what we'll call the thoracic. Now, from the name, yes, okay, pertaining to, and from thoracic, you can mean it says, okay, that it came from the bird. Thorax. And that's as I said up here, when, okay, as the word ends with X, but you need to put a suffix behind it, okay, the X gets replaced by a C. And it's okay, we're also going to have, okay, as vertebrae. Now here is, okay, the number is going to be no less than 12. So 1 dozen of vertebrae falling within the limits of the thorax, where the word thorax actually is, okay, meant chest. Okay. And, okay, as when labeling, yes, okay, your thoracic vertebrae is going to go from T1 to T12. Okay, so just 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Next level becomes, yes, okay, what we'll call lumbar. And where the word lumbar or AR here is mean, yes, okay, that's all pertaining to. And I mean, yes, okay, will mean. Okay, so I lied. The word lump is actually going to be line, or somewhere wherever that is, that's going to be, it's okay, your waist. Area is okay, pertaining to your waist. And of course, that's okay, we'll still have, it's okay, vertebrae. Now, these are going to be some hell of vertebrae. They're going to be pretty big. And as main as, okay, that's the total of 5. lumbar vertebrae, which means that's okay, will just be labeled as okay from L1 to L5. Now, what we mainly can say is okay that all these vertebrae here are, whether it's cervical, whether it's thoracic, or whether they are lumbar vertebrae, these are not fused. Okay. What that mainly will mean that okay, we can say it's okay, let's just take any vertebrae. We can say it's okay, we have a vertebra above and a vertebra below. What we actually is okay, we'll have in between these vertebrae here is going to be just okay a disc. Okay. And what that disc is going to be called, it's going to be called the inter, because it is in between. Vertebral disc. So the disc between is okay, the vertebrae is going to be called a intervertebral disc. But we only find it in the cervical, thoracic, and lumbar region. Mainly because, okay, these vertebrae are not fused. Okay. Whereas, okay, now we go to the last one. Yes, okay, next one. And I would like you guys to just, okay, be careful here, because this is going to be just, okay, what we can call them the sacral vertebrae. Okay. Now, literally speaking, guys, that's okay, there are going to be 5 sacral vertebrae. But what these 5 sacral vertebrae are going to be is fused. Now, why do we call them the sacral? Well, okay, L is still is okay pertaining to. Okay, so sacral is mainly as okay coming from the word sacrum. So these 5 vertebrae that are fused together actually is okay makes a bony plate which is called the sacrum. Okay, well, when we say sacrum, that's okay. The word for the short word for it is going to be. Do you guys mind if I go to another slide just for a sec?
Sure.
No. Thank you. SCA or SACR is sacrum, which we mean is okay. We'll say it's okay. It's okay. Become sacrum sacral. Exactly. But guys, okay, just switching two letters or two letters switch their place and it becomes a completely different thing. Sark. And what did sark mean?
Flesh,
Who was that?
me,
Good. So guys, please watch out, okay? This versus this. Okay. But it's okay, these are fused. But it's okay, we can still label them as from S1 to S5. But they will still be as okay fused into a bony plate. The last, let's say, is okay part of our we want to call it okay backbone is going to be as okay what we can call it as okay the coccyx. Now it's okay coccyx we can as okay say coccygeal. Now what the word coccyx actually is meaning is tail, or more correctly as okay tailbone. And of course, as okay, guys, these are also going to be fused. Okay. And but okay, there's a little bit okay of discrepancy. Some people say okay, is anything between is okay 3 to 5 smaller pieces of vertebrae that are fused. But we're not going to bother yes okay labeling them well okay. Did that make sense? Okay. So either 3 to 5. So that's why some people say okay, so that just stay with the number in the middle or numbers. Did you guys get that? So yes, okay, this was your division of your spinal cord or backbone. Any questions? Now, just one little thing, and okay, then you guys can go on a break. Have any of you heard of the term cervical cancer?
Yes.
Good. So, what would that be?
Isn't it cervix? Your cervix? Your a woman's
So,
cervix.
what does cervix mean?
It means neck.
Neck. Okay. So, which neck?
Well, it's in a woman's reproductive system.
Okay. They call it cervical cancer because it's in the neck of the uterus. Okay, and now some of you may wonder what is the neck of the uterus. Does the uterus have a neck? Then does the uterus also have shoulders? Does it have arms? Does it have? Nah. Okay. But that's okay. They call it as okay. They call it cervical because it's going that area of the uterus is known as the cervix of the uterus. So when you see cervical cancer, don't think of cancer in the neck here. Okay. But if you say it's okay, cervical vertebrae, well, that's not going to be vertebrae in the uterus. Well, you don't have it there. Okay. That's going to be as okay, vertebrae of the neck. But literally, as okay, the word cervix means neck. Okay. Good guess. Now, what other little thing that can happen here? Usually it's okay, happens in, let's see, this area here. And in these areas. That's like, okay, the two common areas for us, okay? Something going on with your intervertebral disc. And some of you guys may have heard of what they call it's okay, a discus prolapse. What's a discus prolapse?
A slip disc.
Okay, it has something to do with your disc. Very good.
Yeah, where it pops out. The joint or pops out between the or protrudes out like between the bones.
No, not exactly, dear. When we say prolapse, now let's just say that, okay, yes, this here is, okay, was your disc. Now, what mainly is, okay, happens in case of a prolapse is that, okay, yes, the space between the two vertebrae decreases. Usually, guys, when the disc or we can say, okay, it's going to intervertebral disc hernia. That's when it will protrude. And usually, as okay, what may happen is that, okay, yes, it may actually just, okay, touch up against the spine. And that can be ouch. A prolapse, dear guys, also can be ouch. Because, okay, what mainly is okay, what the spine mainly is okay will be doing at the levels in between vertebrae is that's where it's okay, it sends out nerves or receive nerves. And due to it's okay, the reduced space between the vertebrae, that nerve is okay, may get pinched. And that pinched nerve can also be ouch. Did that make sense?
So it's just a herniated disc, right? Yeah.
Herniated mainly mean that, okay, I said protrudes out.
Okay.
Whereas prolapse is more like, okay, we can say the space between the two vertebrae is reduced because. Okay, guys, take a short break and I see you guys back at 11. Is that a fair deal? Okay, guys. Now then let's just talk about the planes of the body. Nah, we don't mean those planes, okay? What remains is, okay, let's consider the planes of the body or B is imaginary lines. Drawn to divide the body. Okay, guys? Now, guys, as far as the planes of the body are concerned, we mainly have 3 main planes. Principally. The first one is going to be the sagittal plane. We can say the next one is going to be the transverse plane. And the last one is going to be, it's okay, the frontal, which we also can call the coronal plane. Okay, guys? Now, for 2 of these planes, just think of the body like this. Now the sagittal plane. Okay. Now that's means okay, going to, we can say, okay, run in the way that it divides the body into right and left. So like this. That's how the sagittal planes run. Did you guys get that? So just think of, okay, as a chainsaw. Anybody ever handle a chainsaw? Now don't do that in practical. But if you take a chainsaw and go bow, bow, bow like that, that is like, okay, as slicing something in a sagittal plane. Did you guys get that? So mainly as, okay, so if you go like this, what do you have? A left half and a right half. Okay, so maybe that's okay, a plane which is going to just, okay, divide the body into a right and left part. These planes are going to be called sagittal planes. Now, guys, for your sagittal planes, there's going to be as, okay, the sagittal plane that runs right in the middle. Middle sagittal plane is going to be called the mid-sagittal plane. Did you guys get that? Okay. For all the red lines, and yes, okay, even the green line, yes, okay, is sagittal planes. But the green thing is, okay, that runs right in the middle, or the sagittal plane right in the middle. That's why we call that, or we refer to that one as being the mid-sagittal plane. Okay, but whichever sagittal plane you're talking about, we can just say, okay, if for instance, okay, go with this one here. Okay, what it would do? Well, okay, you can say it would divide the body into, yes, okay, or in this case, it will be right and left. Okay. Even if you go with this one, it's okay, divide the body into a right and left. Even if you went with this one here, it's okay, it will still divide the body into, it's okay, a right and left. Did you guys get that?
So is it basically just like a side view?
No. What do you mean by side view? No, that's
No.
just right, like this. These are sagittal planes. Okay. Did you get that deal? Okay. Now you can say as, okay, if you take a chainsaw and go bam like this, and you say, okay, we remove this part here. And now look at inside of the body of this, that's going to be as, okay, a sagittal view. Did that make sense? Or what we literally as, okay, we'll call a lateral view. Because, okay, you look at the way, as, okay, you look at the body from the side. Okay. But you guys don't need to worry about yes, okay, the chainsaw, but mainly it's okay, just imaginary lines that goes like this are going to be as okay called, would be as okay sagittal planes. Clear? Okay. But what they do is, well, okay, yes, along a sagittal plane, yes, okay, what we'll do, divide the body into a right and left part. Did you guys get that? Good. Now the next fellow is going to be transverse. Now just before yes, okay, going into yes, okay, what the transverse plane is going to mean or do, just look at the word transverse. Because I mean, yes, okay, we'll tell you. Across. Whereas, okay, when we talk about transverse plane, what is that going to do? That's going to just, okay, divide the body into, now what we can say is upper and lower. So your transverse planes are mainly going to be like this. Did you guys get that? So that's okay. If you now take the chainsaw and go, bow, 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 like that, that's pretty much okay as slicing me in a transverse plane. Did you guys get that? So what is going to happen is, okay, if you slice here, you will have an upper part and a lower part. Have anybody ever been to a circus? Nowadays, you don't have to go to a circus. They show the programs on TV, American Got Talent and all that, right? But where they put somebody in a box and then the media is okay with those big blades go, right? Good. Right? And that's the transverse plane. Now, guys, just a few other words which mean, yes, okay, we mean upper and lower. Other words for upper can be superior, and for lower, an equivalent is going to be as okay, inferior. Superior will mean upper, inferior will mean lower. You can say supra and infra. And guys, okay, when referring to yes, okay, upper and lower, and especially it's okay when we talk of the torso, this part here. Upper can be cephalic. Lower can be pelvic. Upper can also be cranial. And lower can also be as okay what we may call caudal, caudal. Where the word caudal mainly as okay come from the word caudal, which means tail.
Sorry, what is that word after caudal?
Tail.
Oh, tail.
Okay. So what they mainly as okay may think is that the coccyx is the remnant of the tail. Okay. If we were derived from monkeys. I don't think so, but if that was the case, then okay, yes, honestly, it's okay. The gorilla in the zoo had turned into somebody else. Okay. So, but they say, well, okay, yes, if we can put a big if we were derived from monkeys, yes, okay, that's what's left of our tail. So, anyways, goody moody booty. Now, guys, when you guys go for your scanning, you guys don't mind if I just go to another slide, right? Okay. Because you will see the word sagittal. No, the main that's okay, we'll just as like a abbreviate that as sag. And you will see the word transverse, or the may just go tran. Okay. Scanning of an area of an organ of the body. So what would the trans mean and what would the sag mean? That's mainly as okay, just going to be the way in which you will hold your transducer. So when we say sagittal view, that's mainly because okay, your transducer will be held like this. Whereas okay, if they say it's okay, a transverse view, that's mainly because okay, you will hold your transducer like this. That's pretty much it. So we call it as okay, sagittal view mainly because you hold as okay, play your transducer along a sagittal plane. Where you say it's okay, transverse view, whatever structure is because okay, the transducer is placed along the transverse plane. Did you guys get that? So that's okay. For your liver, you may be, for instance, let's say it's okay, have to create sagittal views and transverse views. For a vessel, you may have to produce sagittal views and transverse views. Okay. So those are mainly as okay, do you hold the transducer in the sagittal plane? That will be a sagittal scanning. you hold the transducer in a transverse plane, it's going to be a transverse scanning. Did you guys get that? Okay, so now for our last, last one here, frontal or coronal. Okay, let me just take you guys to another slide. Okay, guys. So that's okay. Four is okay. What we can call the frontal. Now this plane here is okay. May also be known as coronal plane. Now maybe it's okay to be able to just okay clearly demonstrate that. Let me just make our Mona Lisa. Here we go. So what is that? The frontal wave is, frontal wave, sorry. Frontal or coronal plane is going to do. That's going to just okay divide the body into the front and back. So frontal or coronal planes mainly is okay, goes like this. Did you guys get that? Now, guys, we can say it's okay, or maybe it's okay, another word for front. Will be as okay, anterior. Another word for front or anterior is going to be ventral. Whereas for back, is going to be posterior or dorsal. The word anti actually is okay meant before. So something that is before you or in front of you, that's why it's also okay, anterior. Whereas the verb post, as we said the other day, meant after. Okay. Did you guys get that?
I just have a question.
Go ahead, Emma.
So basically, is the frontal plane basically like this the sagittal plane, but from a side view?
You can put it that way, yeah.
Okay,
Okay.
thanks.
So, my dear, this will be sagittal. Clear? Okay. Whereas you say, okay, what will be frontal? Well, okay. Pion, pion, pion. Did that make sense?
Yes.
So get your chainsaw and get started. No. Okay. Okay. But you can even say, okay, if you look at, okay, as a loaf of bread. Okay. You have a loaf of bread. Okay. Sorry. This is a loaf of bread. Yeah, okay. Now my idea is, okay, if you slice it like this. Okay, or if that loaf of bread was standing up, yes, okay, that was going to be transverse. Okay. If you slice it from up here like this, that would have been sagittal. And okay, as if you slice it like this, that would be a frontal or coronal. When we say, okay, slice sagittal, yes, okay, it goes down like this. Of course, okay, here, yes, okay, you will have to have the loaf of bread. It's okay, standing up. Because, okay, all these terms here, I mean, it's okay. May going to be referred to as, okay, as if the body or the person is standing straight up. Okay. The actually is okay is a position that we call is going to be what we call the anatomical position. So all anatomy is going to be discussed. Consider the body being standing in a position called the anatomical position. Okay. Now, guys, now your book may yes okay to mention yes okay 3 tests. MRI scan. Now, guys, for your X-ray, okay. Now, the reason that they call it an X-ray is mainly as okay due to as okay the type of rays that are used to create an X-ray. So you may have heard of okay as alpha rays, gamma rays, so on, so on, so on, so. So your X-rays was okay as, or he named the rays that are used to produce what we call an X-ray image. Okay. Now just keep in mind, guys, okay, this is radiation. So X-ray is radiation. And that's why it's okay. Although it's okay, a lot of okay, we can say it's okay. Ways by which it's okay, we obtain an image or a picture of your, yes, okay, anatomy, if you want to put it that way. Still don't use radiations. Okay, that's why, yes, okay, they're going more and more off the word, yes, okay, radiology. Right. So a term that you may come across nowadays is more like, okay, diagnostic imaging. Diagnostic just from diagnosis. Imaging is, okay, producing a picture. Okay. But the reason that they used just, okay, call it radiology back in the day was mainly as, okay, that the primary as, okay, imaging modules was using radiations. So from radiation came radio or radi, or is just the combining vowel, and then logic. So your X-ray doctor or is, okay, CAT scan doctor or so on so he or she will be the radiologist. Okay. Now we can say, okay, the limitation of, okay, yes, your X-ray was that, okay, yes, it could mainly, yes, okay, only give us two types of views. We could mainly, yes, okay, I like it, yes, okay, what we will call as, okay, a frontal view. Right. Now, usually, that's okay, they wanted to take a frontal view, and if you look on your page 30 or 57, figure A, or figure is, okay, 2.8A. That's a frontal view. Okay. Now, how that mainly is, okay, were prescribed that they wanted an image like this. What they'll say is, okay, give us an AP view. The A mainly is, okay, stands for anterior, and P will stands for posterior. So AP view. The other kind of view that you could get from an X-ray was mainly as, okay, going to be as, okay, what we call this, okay, sagittal. And now usually as, okay, that's what you see as, okay, B. But that mainly is, okay, if that was required, then that would mean is, okay, they would not say take a sagittal view, no. They will prescribe it as, okay, a lateral view. Yes, okay. Your CAT scan, which is mainly as, okay, on, as, okay, what you see figure C. Now, CAT scans, guys, only as, okay, give you as, okay, transverse view. So what a CAT scan mainly is, okay, just do as you're being scanned is boom, 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 boom. Yes, okay, or let's do it like this. Take a picture here like this. Picture here, picture here, picture here, a picture here. And may is, okay, place those slices side by side. Okay, but they only give it to you in a transverse view. Like May says, okay, just slice the body along the transverse planes and create an image. Okay, guys. Now, some of you may say, what does CT stands for? Now, C means computed. And why computer? Mainly because, okay, this is computer operated. And then there's going to be as, okay, the T, which means, okay, just stands for tomography. That graphic here is okay, mainly is okay, indicator, okay, this is an image. And the tome from tomo came from tomi, which meant cutting into. Now mainly it's okay because this transfers here also can be called axial. That's why it's okay. Somebody may even call it okay. Like this, or it's okay. What became okay is a CT scan actually becomes a CAT scan. Which just become okay as a computed axial tomography. You guys get that? Now your MRI. And you may that's okay, we'll just see that on page 58, figure 2.9. Now, MRI stands for magnetic resonance. And the I is just imaging. Now, an MRI, my dear guys, is going to just okay give you an image in along all three planes. So it gives you just okay both. Sorry. Sagittal, which is what you just okay see and see. It gives you just okay frontal that you see in A. And it can even just okay give you the transverse, which you see in B on page 58, figure 2.9. And the reason that we call it magnetic resonance imaging is because this thing here is okay, use a hell of a magnet. So that big donut there in the MRI machine is a humongous magnet. Have anybody ever tried to get an MRI done? Good. So what did they tell you to do before getting in? Yes.
You got
Or
like
getting your MRI, what would you do? Scooby-Doo.
you have to like remove any jewelry or anything on your body that
Any visible jewelry.
Yeah.
And even the invisible jewelry, right? Good. Why is that?
it's magnetic, so you don't get up to the MRI.
Yeah, it's a strong magnet. So it's okay. A lot of that jewelry is okay, can be magnetic as well. Not to talk about that, guys, okay. What it mainly is okay will do is it will warm up or heat up those jewelries. Now, I remember a case, not that I personally saw her, but there was a TV program about like healthcare and so on, so on a weekly basis. And where one day had okay as a radiologist, coming in along with a dentist. And especially talking of things such as tongue piercings. Just give me a sec, guys. Really sinking. Antenatal. Where alias is okay or pertaining to the word nat. Mainly come from nate, which means birth. And ante, this is before. Did you guys get that? Now, some people may, as okay, just replace the word ante with pre. And then it's becoming okay, pre, need. Oh. Or still, yes, okay, just still mean, yes, okay. Before. Birth. And the L will just be, it's okay, the pertaining to. Or pertaining to before birth. Did you guys get that? And we can just, as okay, just look at the word nat here. You can just, okay, need, which in this case are going to be born. Now we can take two needs. We can say it's okay that somebody was going to be neo here actually means it's okay, is the old version of new. So back in the day, we used to write new like this, N-E-O. But it just means new born or new or so. What can be another need? May not be practical. And then you just go, yes, okay, Renata. What did the word re mean?
Before? No? Oh.
Again. So what would the word or name Renata mean?
Born again?
Or reborn, right? Good. What's her name? What would be another term for SOK being born again?
Reincarnation?
Good. Do you believe in that?
No.
Nah, okay. So you don't believe that you will come back? And what's your form? It's just another way of saying it's okay, whatever you do in this world, it's okay. It's going to ahead depend upon what happens to you in the afterlife. Whether you call it heaven or hell, or you may come back as okay as or 7. Okay. I guess none of you believe in that. Everybody? Okay. Just take a lunch break, guys. And when we come back, we can talk. Yes, okay. Between your bites, just think of okay, yes. If I was to come back, what would I come back as? Anybody from Egypt? You're from Egypt.
Yeah, I was born in Egypt.
Okay. So you know Hosni Mubarak?
Yeah.
Okay, guys. So let's just try with our words here. Okay. So first would be abdomen, or we may have a combined vowel. O. Which mainly as okay is going to mean abdomen. Okay. Now we can say abdomen. Now, although it's okay, a little vague of a term. That's abdomen. And we can say it's okay. Algia. It just becomes well, the whole word becomes just okay in terms of a condition of pain in abdomen. Yeah, okay, or abdominal pain. Okay, and please, that's okay. We just talked about it. Abdominal cavity. We can see as okay. Next is anti. And as I said, that the word anti meant before or front. Or yes, okay, that we say yes, okay. The main word that we yes, okay will be using when we say yes, we use anti is going to be anterior. And mean yes, okay, what does mean? In front of. Did you guys get that? Okay. So these are mainly going to yes, okay. That's going to be yes, okay. A term that we may use a lot of when we try to yes, okay, let's say explain the relationship between the positions of different body structures. Right. Did you guys get that? Right. So we can take an example where we use the word interior, and we can say that the nose is let's say it's okay, nose tip is anterior to the cheeks. This is in the front, and that's back. Or if he is okay, just draw any person's nest is okay, standing like this. Now we can say it's okay. Anything here is going to be anterior to anything here. Okay. We can say it's okay, anything at this point here is going to be anterior to anything here. Did you guys get that? Okay. So a term that you will hear a lot of. Okay, now please be aware that, okay, yes, you may not always, as okay, see the word anterior. So the word anterior can also be as okay, or can mean as okay be replaced in a text, in a question, exactly by the word ventral. You can mainly say, okay, that the red or the R pink is ventral to the green. The green is ventral to the turquoise. Okay. And okay, yes. All of these are ventral or anterior to the red. Did you guys get that? Wrong. Maybe that's okay, or we just can call it's okay the Aries. Or there's actually that's okay going to be something that we'll call it's okay the bronchial tube. Now the reason that we use the word tube is mainly because that's okay, it's a tubular structure. Okay. And bronch is okay, as from bronch, and EIL is going to be pertaining to. Now, if you need to, it's okay, this may be, it's okay, accompanied with or combine a vowel O. So, what can we do? We can say it's okay, bronchoscope. Okay, which means it's okay, would be a tool that they use to look inside the bronchial tube. Performing that procedure will be bronchoscopy. Okay. What they may obtain at that can be as okay a bronchial biopsy. If they obtain as okay a specimen of tissue because they saw something. So that specimen from the bronchus, yes, okay, will be as okay a bronchial biopsy. Okay. Now, next word, cervix. Which primarily as okay was cervix, which meant neck. Now, as I said earlier, yes, okay, we could say cervical vertebra. Okay, the vertebra in the neck. We could also say cervical cancer. Where here is okay. This is still yes, okay, the neck. But that's going to mean it's okay. In this case, be yes, okay, the neck of the uterus. Now, guys, you may on yes, okay, that's okay about yes, okay, the verse cervical C is okay a table 2.1. Okay. Now it would be yes, okay, ideal to yes, okay. Remember this one here, or remember this table. Okay. But what we can do is, yes, okay, since we are at it, we can mainly yes, okay, just fill it up with okay some alternative words as well. Okay, so anterior, we said front of, and front of, right? Okay. Another word for that would be ventral, ventral. Okay, guys. Posterior, back. So yes, okay, we just look at our picture here. Oops. This is the side view of a person. You can mainly say that, okay, yes, the green is posterior to the purple or pink. The turquoise is posterior to the green or pink. The red is posterior to the turquoise, it's posterior to the green, it's posterior to the pink. Okay. So something which is anterior to something else, the relationship just flips over. So you can say, okay, the green is posterior to the purple, or pink, sorry, whereas pink is anterior to green. Did you guys get that? So it was just like, okay, yes, two buddies met. And now here's you may have heard this one. But and one of them asked the guy, so where is it you're living? And he said, okay, just in front of the post office. And the guy goes, so where's the post office? And he says, just in front of my house. And then he goes, but where are they? And then yeah, he just say, okay, yes, just in front of one another. So, okay. Now it had been nice that he had said, okay, the post office on this street. I just live across from that one. But of course, that's okay if the post office is right in front of your house. Then okay, your house is going to be right in front of the post office. Okay, so and where are they? Yes, okay, just in front of one another. So good. But okay, another word for yes, okay, posterior is dorsal. Okay. This here is the dorsum of my hand. This is the back side of your hand. Okay, so this will be the dorsum of your hand. Good. Inferior, below. Now we actually looking at in terms of height. So inferior will be below. You can also go infra. Okay. And if you talk about the torso, pretty much okay, it's from here down to the pelvis. Then for torso, yes, okay, you can use terms such as pelvic or caudal or inferior. Did that make sense?
Is and superior is the upper part?
Then it will be up.
Okay.
So superior is going to be above. Clear? Okay. But my dear, listen, you will always say, well, okay, this hand here, if you look at the position of them, this hand here that I'm moving is superior to this. Did that make sense? Okay. Where you can say this hand here is inferior to this one here. Okay. So you always will have to, yes, okay, relate to, yes, okay, the structure or yes, okay, whatever it is that I'm talking about. You have to relate it to something. But mainly, okay, when you talk about the positioning of it, it's going to be, is this above or below? And what is it that it is a below? It's going to be below from this. Did that make sense?
Yes.
Right, okay. Whereas, okay, when you talk about superior and inferior for your torso, pretty much, okay, from here down to the pelvis, those relative terms can also be, as okay, superior can also be referred to as cephalic or cranial. And your inferior can be referred to as pelvic and caudal, C-A-U-D-A-L. Did you guys get that? Good.
Can you repeat the last part one more time, please?
For inferior?
Yeah.
Pelvic and caudal, caudal. And that's why I say SOK mainly SOK refer to the tail. So if you had a, or if you once had a tail, yes, okay. Okay. Good. Lateral side. So guys, and the opposite of that is going to be medial, which will be middle. Clear? Okay. So what can you say? Yes, okay. If you look at the, let's say the face, you can say, well, okay, the ears are lateral to the, let's say it's okay, cranium. Or you can say lateral to the nose. Where on the opposite side, you can say that, okay, yes, the nose is going to be medial to the ears. Or if you just look and say, it's okay, the nose is medial to the eyes, which means you can make the eyes lateral to the nose. Did you guys get that? So lateral literally means sides, medial, middle. Okay. Whereas medial, okay, just midi or media is middle. L or the L means okay, just becomes pertaining to. So media mainly as okay means middle. And then you have social media or digital media or print media or whatever, right? Okay. Be in the middle, be in the spotlight, if somebody know what the hell that is. Okay. As I just said the other day, intermediate. The inter was inside, or in between, sorry. Media, middle. Okay. So in the middle, you know. Okay, and the next two terms, let's just for a sec, just skip those. I'll come back to those in just a sec. Okay, guys? The distal and proximal. Deep and superficial. Now, superficial mainly is okay, will just mean is okay on the surface. So superficial, just on the surface. Okay? Where you say deep, that's me is okay, going to be as okay, digging deep in. So yes, okay, if you look at a person and you say it's okay, superficially, it's okay, what is that you see? Skin. Okay, so skin is going to be as okay, superficial. What are you going to have underneath the skin is going to be deeper to the skin. So you may have, okay, fat, you may come across muscles, and so on, so, and you may enter into, as okay, let's say a cavity as you dig deeper and deeper. I just think of it as okay, if you know how to swim and you are not in for scuba diving, you probably as okay want to stay on top of the water, right? No, walk on the water, but just okay, just stay on the top. Okay. Okay. Whereas okay, if you're into scuba diving, okay, yes, then you want to go deep. Did you guys get that? So superficial is on the top, on the surface, pretty much. Deep is digging down deep. Is anybody clear about that? Okay, guys, the last two, supine and prone. Now, those are mainly as okay, just terms which are related to if a person is, lying down. Now, if somebody as okay is lying down on his back, you're lying on your back. How many mean? Facing upwards. That is going to be as okay, be lying supine. Whereas if you lie on your stomach, and if you lie on your stomach, yes, okay, your back or is going to be facing upwards. Okay, that will be prone. Have anybody ever tried to go for a back massage? Okay, but when you go for that, yes, okay, what do? You lie on your stomach so that they can massage your back, right? Yeah, okay, so that's okay. In technical terms, will be to lie prone. Okay, guys. Now the two words that we skipped, distal and proximal. Let's just make a Mona Lisa. Here we go. Now both these terms here proximal or distal. Now we primarily as okay use these terms here as okay for our limbs. Now some of you will say what are going to be the limbs? Your arms and legs. Did you guys get that? So these two terms here are primarily as okay used when we refer to the limbs. Arms and legs and hands and feet. Now proximal. Mainly as okay is going to be as okay, you can say any point or relative point. That's going to be as okay closer to as okay where the limbs are attached to the body. So in this case, yes, okay, we can say that okay, yes. For instance, the shoulder. Now that's going to be proximal, but proximal to what? You can, for instance, say yes, okay, we have the elbow. So you want just okay to find the relationship between shoulder and elbow, or elbow and shoulder. You can say that okay, the shoulder is proximal to the elbow. Whereas if you go the other way around, you may say that okay, yes, the elbow is distal to the shoulder. Okay. You can even go and again and say yes, okay, well, if we say elbow here, now elbow may be proximal to, let's say, yes, okay, your wrist. But maybe it's okay, just makes your wrist distal to the elbow.
I don't understand that because it's the same distance.
No, it's not the same distance there.
So
It's
the
not a
elbow.
matter of, it's not a matter of distance. It's
Okay.
not a matter of distance. You can say,
Okay.
well, of course, the distance between the elbow and the shoulder and the elbow is going to be the same distance. Right?
Yeah.
Okay. The distance is going to be the same. Okay, because you say, well, okay, I traveled from this address in Milford to this address in Stamford. 25 miles, for instance. Well, okay, it's going to be 25 miles traveling back from Stamford to Milford, right? The distance is going to be the same. Okay. But this is mainly as okay, as I said, well, okay, when we as okay, want to establish, as okay, talk about, let's say, the relationship between the shoulder and elbow. Okay, you will mainly say that, okay, yes, the shoulder is proximal to the elbow. Did that make sense?
I have a question. Oh,
Just a
sorry.
sec, my dear. Just a sec. No problem. Whereas, okay, on the other hand, you can also say, well, okay, then, okay, now the elbow is proximal to, for instance, okay, the wrist. But if you just switch the words, okay, then we mainly as okay, we'll be able to say that, okay, yes, the wrist is distal to, let's say, as okay, elbow. It's also going to be as okay, distal to the shoulder. But
Does it have to do with like the cephal, like your head down? Is that why it's one is like? Does it have to do with that?
No,
I'm
my
just
dear.
reading the book. I'm just looking at this book. So the top one is always proximal, right? Because it's from the head down. Is that right? That's what you said before, like at the beginning of last week. Because it says near and far.
Near to the attachment.
Okay, yeah.
And far from the attachment.
Yeah, but it comes from the head, basically. So everything is
No,
proximal.
not for the head. These two words, my dear, are specifically used only for your limbs.
Limbs. Okay.
So anytime you're going from bottom to top is going to be distal, and anytime you're going,
you can say, so you go from bottom to top, you say I start distally and I go proximally. Did that make sense? Okay, so you start from here. Proximal most, right? Okay. Now I'm just moving distally. Or I'm moving proximally. Okay. Okay. But when you say as okay, something is proximal or something is distal, you have to specify as okay, proximal to what? And distal to what? Just like you say as okay, such and such structure is lateral. Lateral, but lateral to what?
Can you use any body part, like on, depending on the word?
Like,
I said, can you use any body part to compare it to, like a different, like arm, let's say? If you were gonna say it's like on the opposite.
Now, well, okay, then for the foot or leg. So these two terms, distal and proximal here, are specifically used for what we can call the limbs or extremities. What will be your limbs or extremities? Your arms and hands and fingers, and your thigh, your leg, and full feet and toes.
So just a question, would would the knee be proximal to the foot?
Pretty much, yeah.
Okay. Get it.
Okay. You can say hip is proximal, or the hip is going to be proximal to the thigh. It just makes the thigh being distal to the hip. Now, knee is distal to the thigh because the thigh is going to be proximal to the knee. Did that make sense? Not just for proximal and distal, guys. Whenever you use any of these terms, especially it's okay, besides the last two ones, you have to say, well, okay, you say, okay, I'm mentioning that this structure or body part or so on organ is anterior. You have to say, okay, it got to be anterior to what? You say, okay, my forehead is anterior. Anterior to what? Okay, so these are relative positional terms. You have to establish the relationship.
One more question. Shoulder to shoulder. So would that be still be proximal or distal, or is that a different word?
No.
Totally different. Okay.
Because, okay, shoulder to shoulder, that's when you go side to side, right?
Yeah.
Okay. So that, no. Okay. It's mainly as, okay, when you say, okay, right arm, for instance. Okay. Now here is, okay, I'm proximal most. Okay. Now if I move this way, I'm moving distally. When I'm moving this way, and so mainly as, okay, just naming structures. When I move like this towards the shoulder, I'm moving proximally. So what I started off with here is going to be distal. And as I move up, I say, okay, anything that comes up here is going to be proximal to yes, okay, or was by my watch. Okay. So if I, for instance, okay, we're wearing 4 or 5 watches here. Okay. Just a crazy example. But anyway, you can say, okay, this watch here, that will be as okay, distal because I had another watch here, another watch here, another watch here, another watch here. So Apple Watch would be distal, Citizen, proximal to Apple, Rolex, proximal to both, so on and so. But when I go in the opposite direction, I say, okay, Louis Vuitton watch, then okay, this one, and this one, and this one, and this one, bump. Apple Watch was the distal most. Okay. But whenever you use any of these positional terms, guys, it's not just going to be good enough to say this structure here is distal, this structure here is proximal, this structure here is lateral, this structure here is medial, this is anterior, this is posterior. You have to give a reference that you say, okay, this structure is anterior, but anterior to what? Did that make sense? This structure is lateral. Okay, good. But lateral to what? Okay, this structure is superficial. Superficial to what? Did that make sense?
A quick example. So would the chest be inferior to the head?
pretty much.
Okay, I'm just writing examples.
Right, okay, you can say as okay, your abdomen is inferior to the thorax. Pelvis is inferior to the abdomen. And since it's inferior to the abdomen, you can also, of course, there's going to be inferior to the thorax as well. It's going to be inferior to the head. Or just if you look at your face, you can say it's okay. Nose is superior to mouth. But if I say nose is superior, well, okay, superior to what? I have to refer to as okay. Okay, I can say mouth. It will be correct to say it's okay, chin. Did that make sense? By just saying it's okay, such is superior. No, that's not enough. Did you guys get that? Okay, now just a little cheat. That's okay. Some good 31 years ago. Some good 31 years ago. Yeah, 31 years and a month ago, to be very specific. I was in the same shoes as you guys are now. So what do you do, or Scooby-Doo, what do you do when you have a problem understanding something? You create a cheat. Now my cheat to understand distal and proximal. What I say is okay, distal. I just talked on the word distant. Which man went, okay, yes. Far away, right? That makes sense. So I just have to remember as okay, when anything was okay, farther away from, that's okay. That become distant. So you can say it's okay, the distant most far, or it's okay, point of your upper extremity is going to be as okay, the tip of your middle finger. Right, okay, that's the distant most part, or point. Or pretty much okay, as you move away from, yes, okay, where your limbs is attached to the trunk or torso, you are moving distally. I mean, it's okay, just naming structures as you move that way is, you can say, all these structures that will come across are going to be distal to us, okay, the structure that I started from. Where you move the opposite way, you start distally and move proximally, that's okay, up, you are moving proximally. So all structures that I will come across are going to be proximal to Oros head at the wrist. Or just think of the word approximate. Now, if you are doing a renovation or something in your house, you get an estimate, right? Okay, what an estimate is going to be, an approximate estimate. Okay, the contractor may say, well, okay, and that's why they may say, it's going to cost you around What do they mean around by the word around? Something close to $20,000 or something, right? Good luck with that renovation of a bathroom. Okay. But you may be in for a big surprise because, okay, that bathroom that you thought was going to get fixed for 30,000, that's okay, it goes up to 35,000 or 40,000. So that's why they say it's okay. That's why they use the word around. And approximate estimate. Did you guys get that? That's okay. I just use the word distant to that's okay, far. Any questions? Nope. Put. Ponder. Now, I think I already talked about this fellow here. Chondrous cartilage. Right, okay. Where do we have cartilage? Here, okay, earlier, it's okay, when we talked about, it's okay, the intervertebral discs. They were discs made up of cartilage. So in most joints, and I'm not saying all, but in most joints, yes, okay, your bones will have cartilage. Yeah, okay. Now, since cartilage was a connective tissue, and we says, okay, chondroma. Chondroma became a benign tumor of cartilage. Whereas if we said malignant tumor of cartilage was going to be chondrosarcoma. Okay, where the sarcomas were going to be malignant tumors of connective tissues. Okay. Any questions? Now, all of these words are pretty much okay as hell. I talked about them. Cranial. Okay, now cranial is skull. A cranius, skull. Skull. Now we can say, or we already did it, cranial. When we say cranial, it's okay. We just, in this chapter, talked about cranial cavity. You can even say it's okay, cranial bones. Bones of the cranium, bones of the skull. We can even go on and say intra cranial, which just would be as okay pertaining to skull. But what about the skull? Inside of the skull. A word that you guys may hear can be as okay intracranial pressure. And that is okay increases. That's a mess. Okay, what can cause that? Concussions, road accidents, and so on. So, and that's why patients that's okay may go into comas and so. Did that make sense? Clear. So you just have to put ting, 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 word and word together. That's how it's okay. All most of these terms here are being made up. Now, what may be needed to be done if you have an increased intracranial pressure? They may do something with your skull, which may be, it's okay, yeah. Cranie. Oopsie, oopsie. O. Tommy. A cranie was skull. O is just as okay, our favorite combining vowel. And Tommy would mean cutting into. So you can say it's okay, you have the skull. Now, take this out. Whatever caused the increase of pressure, remove that, put bone back and so on. So, but that already is okay, what they call a craniotomy. Back in the days, they used to call this the burr hole. Now, in that time, it's okay on the right between what you call it, Fairfield and Reading. There's a street called Burr Street or Burr Road. Have you guys seen that one? No, nobody travels on the Merritt?
Yeah.
Okay. I think a little bit past exit 44 if you go south. You'll come across Burr Road. Anyways, good. What else can we do if you don't want just okay, make a big cut into the skull? You can do a cranioscopy. Clear, okay, where they just use a cranioscope. Epitel or epitally. Mainly as okay when it says okay, epitely is going to be Common term that is okay, we may come across going to be epithelium, which is just that's okay now the name because we end with M, UM. Where we can also say epithelial, pertaining to epithelium. Okay, so usually it's okay, we may say okay, epithelial tissue. Now here it's okay, you don't need to say epithelium tissue because the word epithelium itself, that's okay. Actually, would mean that you just okay, talk about the epithelial tissue. Okay. As I said earlier, it's okay when we talked about the word epi, pretty much okay, as would be a suffix in itself, which means okay, will mean about. Esophag. Okay. Now, just so you guys remember that the word fag means to swallow, or it's okay. In some case, we may even it's okay go and say engulf. Have you guys ever played Pac-Man?
Yeah.
Okay, good. What is it a Pac-Man does? That is engulfing. Or you can say, it's okay, when you ease your way through. Okay, that will be engulfing. Ease your way through what? Whatever chocolate labyrinth that you're stuck in. Good. So, but esophagus, okay, now the structure itself, please, so it's not going to be esophagum. It's going to be the esophagus or esophagus. Okay, but we can say it's okay. You can go and it's okay, be esophageal. That is as will be as okay, pertaining to the esophagus. Okay, and usually it's okay if you said esophageal, it's going to we're going to actually say it's an esophageal tube. If you're talking about the tube itself. Okay, you may say it's okay, or you may come across the word like esophageal cancer. Okay, it will be correct to say esophageal cancer, or you can also say cancer of. I guess you're not going to be using the word esophageal, but you're going to be using esophagus. So esophageal cancer or cancer of the esophagus. Right. Now, okay, this is a little bit too aggressive, but it's okay. We may add a very little instance talk about it, okay, something that we'll call esophageal varices. Okay. So the question just is, okay, where in the blue is it that varices are? They're just going to be swollen veins. Swollen veins. Now, when we find those in the esophagus, we call them esophageal varices. You find those swollen veins in the legs, we call them varicose veins. If anybody ever heard of that fellow. Okay. You find those swollen veins in the anus, sorry. That's what it's going to be what you call a hemorrhoid. A hemorrhoid is nothing but just a swollen vein in the anus. And if you find those swollen veins around the belly button, they were referred to as spider nevi. Just meaning as, okay, spider's web. Or, none of you are Greek? No, I asked that earlier, right? Okay, none of you are Greek? Not even 1/10 of you? Not even one Greek gene? Nah? Okay. Maybe somebody are, but they don't know about it. So have anybody ever heard of Greek mythology? So that spider nevi or swollen veins around the belly button is also known as Medusa's hair or caput Medusa. Now, does anybody know who Medusa is or was? Sorry. Who was Medusa?
Greek
Wasn't
god.
she a goddess? And then
Greek goddess.
she would,
Okay, good.
and then
What was
she,
a,
oh, if you looked at her, you turned to stone.
okay.
Yeah.
Okay, good. Well, what was about her hair?
They were snakes, correct?
Snakes. Here we go. Now, how did they kill her?
They cut off the snakes. No?
That was Samson.
She saw,
Oh.
was it her own reflection?
Huh?
Mm.
Her own reflection, was it? I forget.
Well, okay, I think something like that. Yes, okay. They made her either look into a mirror or something like that. Or they aimed at her looking at a mirror. Because, okay, it was only if you look her directly at her, it's okay that. Okay. Okay, guys. So that was the esophagus. That's fine. We can check the remaining terms up tomorrow. Okay. Good. Any questions at this moment? Yeah. Nope. No words of wisdom.
Study hard.
Study hard. Oh, hard. Not off the record, guys. I told you